Hello, my name is Sherry Barrett, and I wanted to make a video that might help other people as they're trying to make a decision with what type of breast surgery that they're going to have when they're diagnosed with cancer. I chose to do a double mastectomy with reconstruction, and I would say that if you choose to do that, um, the very important thing to remember is that when you're having both sides operated on, you then have twice as much chance of infections, things going wrong, things of that nature. So I would say it's important to also weigh the option of, do you want to do a double mastectomy, or would you be okay? I mean, I guess if you have a lot of cancer in your family and you've tested positive for the gene, which I did, then you have to ask yourself, if I do have to go back in for a second surgery down the road, am I okay with that? Well, I was actually in the midst of all of my surgery. A lady friend of mine wound up having a reoccurrence in the other breast. And it was like 20 years after she had her first surgery done on one side. So, I mean, it's so personal, that choice. Things didn't go good for me. I wound up having 5 surgeries. I'm switched hospitals now, and I've healed up quite well. I'm looking at trying to find, I don't even know what's going to happen now with the reconstruction. So I need to go in there and find out whatever the doctor is going to tell me about what can be done at this point to make things look better. So that's where I am at. I had the Diep Flap, where they remove a portion of your stomach fat, and then they use that material to make your breasts. So it's your own material. Versus if you wind up having artificial breast implants, then you need to go back like every 10 years or whatever and have them redone. So that's the other thing that they don't make super clear. That's really important. So those are kind of your decisions. What I'm finding now is that I still have areas that are completely numb around my belly button, and also in both of my breasts where I can't feel anything. Also, they had cinched me too tight when they did the first surgery, and they're like, don't remove the wraps. And I'm like, okay. I also went in during holiday time. So if you go in during, November, December, all of that time, a lot of people are on vacations. They're sliding you in and out. They're waiting longer days before you get in for your appointments because people are gone, So it's not the best time to have this stuff done. That's another thing to try to remember. What was I saying? So, yeah, keep all of that in mind as well when you go through it. And no, and the other thing I had a really hard time getting them to commit to me was like, give me a timeline. And they're like, well, we can't really give you a timeline. And I'm like, my husband's going to have to help me with this. And I need to know, is it a month, 2 months, 3 months, whatever. And they really didn't do it. It was 9 months, okay, solid. And also, if things go wrong and they have to not do a surgery, you have to heal up for a certain period of time before they will bring you in for the next surgery. Okay? So what happened with me is they were going to do what is also known as nipple sparing, where they try to save your nipples and your areolas and everything. So saving as much as they possibly could, because of I was 0 to 1 and where they found the cancer. So the good news is when you do the double mastectomy and they take out all the material, they can test to see if they find anything, And so that is what I did. I I had the double mastectomy. I went in there and they removed all the material. They were supposed to, and this is another thing I found out, they were putting in expanders. And I found out with the Diep Flap surgery, they do not need, anyway, I've heard that they do not need to put in expanders for that. Who made that decision and why, I didn't understand how that whole thing came about. But that is what I was told, and so I'm like, okay. They went to do it, but because my blood flow wasn't great, they didn't do it the first surgery, which meant I woke up with nothing, and which is very shocking. They also wrapped me too tight, and it was also the holiday times, and they're like, don't touch the wrap, like don't remove them. Well, I have no idea what's going on underneath there. It's all very shocking. And what they did is they had the wrap on too tight. So I still have numbness in like part of my arm and underneath along my side because they had the wrapper that I was wrapped up in so tight. I still have areas that I have no feeling. So now that I'm going to a whole nother facility, I'll see where I'm at, what can be done, whatever. And so that's kind of where I'm at with that. So anyway, went in for my first surgery. They couldn't do the second surgery, which was to put in the expanders. I had to wait until I healed up more. Then they put the expanders in there, and I started having issues after that right away. I started getting an infection on one side. They couldn't really get it under control. Then I got an infection on the other side. Okay, so now I have two infections going on, two separate infections. And it took them forever to even figure this out. And then they sent me to the Center for Disease Control. And he was the one that was like, yeah, you do have two infections. They're really bad infections. And therefore you need 124 shots. And you'll be doing those at home. And we'll send you over to the hospital to get your PICC line put in, and then you just hook up to that, which is left in your arm. So we did that, and we went over there, and the nurse put that in, and then they delivered all the shots to my house, and my husband gave me all the shots over a period of time for that, to try to get rid of the infection, which is a very painful whole thing that happened there. And so not that the shots were not painful, just the infection was painful. So they did that. And then it came time, my shots were done. Nobody would take it out. The nurse who had put it in was hired for the day at the hospital, was no longer responsible for removing the line that her and all the other technicians that were there were like 5 technicians to put this in. So I had no one. I called my primary doctor. Nobody called back. The other issue with all of this is you wind up playing phone tag, and they have a lot of these places have route your phone calls. So you're leaving it with a message service, which means you can't really leave detailed instructions. You know what I mean? And then you're at the mercy of when they call you back, and if they get you, because you were able to answer the phone when they did call you back. So that's a whole thing. And I did not find anyone, a lot of people didn't call me back. And they're like, oh, well, we didn't do that. Well, maybe I should have called you back and let you know. Primary doctor did that to me. I probably should have called you back. Yeah. So I had to keep that line in my hand for several extra days because no one would take it out. And when I finally went in for my regular exam, even though I had called that place and tried to get them to call me back, nobody did either. And they were refusing to take it out. And I raised hell in the office. And then finally they took it out, and we were having words back and forth. And she was like, well, at least you don't have cancer anymore. Like, what am I complaining about, right? Why am I complaining? I'm lucky. I don't have cancer anymore. you know, because they tested all my material. I didn't have cancer. So my point is that it's not smooth sailing. And the point is that along the way, everything you decide to do can lead to the potential of something going wrong. And I'm sure there are many cases where things didn't go wrong with people. But just to note that things can go wrong. And if things start going wrong, it's not going to be a month or two. It's going to be 3 to 6 to 9 to 12 months of things that you might have to deal with, okay? And I don't think, you know, I mean, yeah, it is bad enough knowing that you have cancer. However, I don't think that they should not be telling you all the information that you need to know, okay, along the way. And I find it very hard to believe that they don't know a lot of stuff that they try not to tell you. You will not look the same. You are not going to look the same. You will have scars, and many times your skin will not be viable. So different parts of that will have to be cut away, which will then change the original plan of whatever they were going to leave you with to then having to change your overall outlook. So due to the fact that I went in and did the expanders and they didn't work, then they had to go in and take them out. They could never inflate them anyway. They had to go in there and remove everything. They have to intubate you each time. And so that can be really rough on your esophagus. And the more surgeries you have, okay, so that's also something to consider, okay? And so once they removed those, then they had to wait before they could do the next surgery. And of course, I had the infection, so then they had to wait for the infection to completely go. And then the last surgery, meanwhile, in between there, I had bad infections. They were trying to remove the infection around the expanders, and they couldn't get it under control. And then my infection started getting really bad and seeping out. And then the assistant, not my doctor, because it was Christmas time, decided to do an impromptu surgery on me. Well, she was, I believe, on the phone with my surgeon, which is probably not even appropriate. So, however, the infection was so bad and everything was so bad that that's why that happened. So, yeah, things can really happen. And it's not really to be frightening or scary, but it is something that can happen to anyone in the situation. So, I was on top of that. Let me see. So, yes, it isn't straightforward. I would definitely find photos and go through photos of what you can look like, so that you really have a good understanding of how things are gonna appear when you're done. And then give yourself time to grieve and go through the whole process of how your body's going to change, and be very patient. It is going to look much different when all the inflammation and everything goes away. It will not be as bad, and you're going to wind up with scarring, you know, and over time, you know, you'll come to acceptance. And like I said, I'm not at my final stage. I am going to see if they can do some more corrective surgical things to make it look better, and to make sure nothing is amiss. And that's where I am at right now. But I wanted to post this because I didn't feel, when I went out online and went on YouTube, that I found a lot of good information. And actually, my doctors tried to dissuade me of going. They're like, oh, don't go out there, because there's just some people who are, like raving out there and, whatever. And yeah, listen to them too. Listen to whoever you find out there that has actually gone through it from your side, which is the patient side. Okay? And because then when you go in and go through if you have to go through different phases, you may not have complications, you may not have all these issues that happened to me, but if you do, make sure you take somebody in there with you if things start going wrong. And so you have somebody that is also there to help you when you're like, I don't like this, I need, something's got to change. Why is this happening? A lot of times the girls that are in there, which are not the surgeons or whatever, that just see you in between visits, they're basically told not to really say anything. They're like, oh, that's a great question, but you don't get an answer. They have little phrases and things that they say, in which sort of just says, we can't, I don't really know, they won't say, I don't know, but it's kind of, they don't tell you. So, and it isn't necessarily that easy these days to actually get the surgeons and get the people on the phone to answer your questions in the middle of everything. I'm not saying, it just depends on where you go, but when you start having issues, if you're at a spot where you can change your situation, then do it. By the time I really wanted to leave and go somewhere else, I was in the middle of everything, and I was very sick and very tired, and I just didn't have it in me. But I swore then that I was going to make this video and make sure that I put it on YouTube. And I'll wait to see, like, if people ask me questions and stuff, maybe I'll make a better one that is outlined more later. But for now, I at least wanted to follow through and get something out there. So that was the main reason why I'm recording this, and why I want to get it out there. And if I can be of any help with some questions, I'll be glad to. If I can interact on there, then I will. So I don't really know. I'm just now gonna end this, and I'm gonna go out there and I'm gonna put it on there. And good luck. Don't be too frightened. You'll be okay. You're gonna be okay. You too can rise above this, and you will come out the other side. It can feel long and hard at times, but you'll be okay. Thank you.